Alrighty, video number one. A lot of tension across the top of the patella, running down into the IT band, and invariably tension and pain through the inside of the knee, right on the joint line. Quick anatomy. Inside of the knee, if I'm holding tension here, if I think of my knee joint like this, if I'm opening up the knee because my IT band is so tight, if my IT band pulls tight over here and I pull the knee open like this as the tension on the outside develops, I'm going to pull a lot of tension on the meniscus and the MCL. So open up the quad. What I'm going to do is I'm going to take my medieval foam roller, and all I'm going to do is, starting at just above the knee, I'm going to work a small section of about 2 to 3 inches all the way up my quad. So I'm doing 2 to 3 inches down here. You know, this doesn't feel super painful. I'm going to work, that's a little bit more tender already. So I'm going to work this section 2 to 3 inches, mashing back and forth. If this portion of the barbell is not enough, I'm going to graduate, Bella, that's my ball. I'm going to graduate to this section over here, and again do the same thing, small 2 to 3 inch section. I'm going to work all the way up my quad, spending about 3 minutes smashing out my quad. The most important piece I find, or the most common issue I find, is that lateral portion of the quad. So I'm going to roll my body sideways slightly, I'm going to lay down my foot, and I'm going to put my knee on top of my foot so that I'm not stretching out that inside edge too much. And the same idea goes, 2 to 3 inch section, mashing back and forth all the way up the side of my quad for about 3 minutes. And if I can, when I get all the way up to the top, I'm going to get all the way in through here to my TFL, and I'm going to mash in here, and it's generally very tender. Spending another 2 minutes or so in the TFL, just mashing, trying to get some alleviation of tension in there. The TFL is the muscle that tenses the IT band. It's the tensor fascia lata, so your lateral fascial plane gets pulled by that muscle. A lot of times I see that the IT band and the quad will kind of stick together. They're kind of stuck together anyway, but the way they stick together, I find is not healthy tissue. Now pulls excessive tension on the knee, and that's what's giving that knee pain. So areas to avoid: right between the TFL and kind of the top end of your vastus lateralis, there's a little section in here that is kind of straight onto the bone. Avoid mashing on that. Anything below that and anything above that, fair game. As far as when you're in this position, try not to roll the leg too far over. I don't have too much of a problem with it, but the way that the femur comes into the bottom of or the top end of the knee, there's a little section where it gets super superficial over all the nerves, and it gets a little crunchy there, so avoid that one. Otherwise, 3 minutes smashing the quad front side, 3 minutes side, and then 2 minutes top.